Welcome, Dr. Genesove, to our spotlight on the healthcare sector plan. Could you introduce yourself for our audience?
Thank you, Henry. I'm Dr. Leon Genesove, Chief Physician of the Ontario Ministry of Labour. I also head up the Ministry's Occupational Health and Safety Enforcement Strategy for the healthcare sector.
What is the purpose of the sector plans?
The Ministry of Labour develops annual sector-specific enforcement plans outlining what Ministry of Labour inspectors should be looking for when they do proactive inspections in the workplace. And we post these on our website so that all workplaces, employers, workers, will know what the Ministry of Labour is looking for when they inspect workplaces.
How are the key issues identified in the sector plan determined?
So to develop the key issues in our sector plans, we look at a number of resources. We're looking at WSIB data, we're looking at field intelligence from our inspectors, our internal data systems. We're looking at also input from stakeholders, including our Healthcare Section 21 Committee, which is an advisory committee to the Ministry of Labour composed of employer and labor unions.
What are the key areas of focus in the 2013-14 healthcare sector plan?
The Ministry of Labour has set several system-specific hazards as priorities for inspection in all sectors. So these include musculoskeletal disorder prevention, slips, trips, and falls prevention, prevention of motor vehicle incidents, prevention of accidents with machineries. And there are also several specific issues in the healthcare sector that we're focusing on. And some of those include infection prevention and control and workplace violence prevention. We also have a number of specific blitzes that focus on hazards in the workplace that run through the year. So for example, in this year, we've had blitzes focusing on protection of new and young workers in the workplace. We're looking at prevention of musculoskeletal disorders in specific healthcare workplaces and protection of workers from hazardous drugs such as antineoplastic agents.
So what can our clients expect when a Ministry of Labour inspector visits for a proactive inspection?
When the Ministry of Labour inspector comes to the workplace for a proactive inspection, they'll identify themselves to the workplace, who they are and why they're there. They'll first meet with the employer representative for occupational health and safety and a worker representative for occupational health and safety. And if there's a joint health and safety committee in the workplace, they'll sit down with the joint health and safety committee. When the inspector does this meeting with the employer and the worker representatives, the inspector will discuss and review the recent minutes of the Joint Health and Safety Committee, recent workplace inspections by the Joint Health and Safety Committee, and discuss any recent accidents or injuries that may have occurred in the workplace and any outstanding occupational health and safety issues that the Joint Health and Safety Committee has identified. The inspector will then conduct a physical inspection in the workplace, walking through the workplace, talking to workers in the workplace, talking to supervisors, asking the employer to explain certain hazards or how hazards are controlled, and looking again at the state of occupational health and safety in the workplace, and if there are any contraventions of the Occupational Health and Safety Act and its regulations. At the end of this physical inspection, the inspector will sit down, write a report with findings, and if there's contraventions of the Occupational Health and Safety Act and its regulations that have been determined, these will be documented in the report. The inspector then discusses the report with the employer and worker representatives for occupational health and safety, identifies any contraventions of the Occupational Health and Safety Act and its regulations, and works with the workplace parties to determine when compliance should take place, meaning correcting these contraventions of the Occupational Health and Safety Act and its regulations. And then finally, the inspector will leave a written copy of the inspection report in the workplace for posting in the workplace and for action by the employer and worker representatives.
PSHSA has seen some benefits for our clients as a result of the sector plan and the blitzes. These include new resources and training programs for our organizations, heightened awareness of occupational health and safety risks in healthcare workplaces, and improved partnerships and collaboration between employer and labor associations such as the Ontario Retirement Communities Association or the Ontario Nurses Association, and ministries that serve the healthcare and community care sector, such as the Ministry of Health and Long-Term Care and the Ministry of Community and Social Services. Can you tell us some benefits you have seen as a result of the healthcare sector plan and blitzes?
Yes, so the immediate benefits are increased compliance with the Occupational Health and Safety Act and its regulations in the workplaces that our inspectors visit. Another benefit is when our inspectors go into the workplace and find there are hazards there that need to be addressed or there are contraventions of the Occupational Health and Safety Act and its regulations, there's increased resources that the inspector can advise the workplace of to use, to take advantage of, to improve their occupational health and safety system in that particular workplace and to increase their compliance with the Occupational Health and Safety Act. So, for example, the inspector will refer the workplace to Public Services Health and Safety Association and to the resources and training tools available from PSHSA to improve the health and safety record in the workplace. Above and beyond that, there's increased awareness of those specific occupational health and safety issues across the sector. So all workplaces, including the ones that aren't visited, are better prepared for occupational health and safety. They're better prepared to protect their workers. There's increased compliance with the Occupational Health and Safety Act in all healthcare sector workplaces, and there's increased awareness that workplaces should be going beyond that and moving towards best practice. In addition, in the healthcare sector, I think this is unique to the healthcare sector, is that the workplaces realize that worker health and safety and quality patient care go hand in hand. In order to deliver quality patient care, one needs healthy and safe workers in the workplace.
Thank you, Dr. Genesove.